in medical doctor and health expert Tuyi Mebawondu to help us to take a look at what's going on in the Democratic Republic of Congo. Thank you very much indeed for coming.
Thank you for having me.
Yes, well, the United Nations, as we know now, of course, says cholera outbreak has reached a very worrying proportion in Congo. As a matter of fact, 20 out of 26 provinces have now been affected. And we also hear that some cities and towns have also, are affected at the moment. What do you think, what do you think was the reason that it was allowed to get to this point? Is it a problem of infrastructure, or is it a problem of government not, doing enough, handling it well?
Thank you. Essentially, cholera is a disease of water, hygiene, and sanitation. Whenever you see an outbreak of cholera, there's something bad about the water supply, about the cleanliness of the water supply. There's something bad about the hygiene, or there's something bad about the sanitation, or a combination of all those things. Now, the most important thing is that when infrastructure breaks down, when the health system is not functioning as it should be, when you cannot easily, pick the disease before they manifest itself, you are bound to see all this kind of thing. And it's also worrisome that when you have challenges in terms of nutrition and health of the people, then you are bound to see this kind of thing. Now, if you look at the case of Congo, we've seen that serially we've seen an outbreak of epidemics, happening there, from Ebola to even the last survey we're talking about, and now cholera. Now, essentially, they've lost sufficient amount of fund from inflow from the sales of oil. That had actually, impacted negatively on their health system, and even in terms of ability to clear waste and then discharge basic public health function. And whenever you see a situation whereby, there's open defecation, where people have to actually, go outside and pass stool outside, the likelihood of you passing that sort of infection is higher. And when the thing comes up, it then depends on the strength of the public health institution to respond and alerting the people on the outbreak of cholera. I was expecting that at this stage now, the Republic of Congo, they will have at least tried to deploy vaccines to deal with this acute emergency. Yeah, we know that even for cholera, if you see 100 cases of cholera, that means that there are times 20 of that, people that are carrying the diseases, and then they're not, that is not showing. And let's appreciate the fact that in Congo, what we're having is actually, an endemic situation of cholera that gets flared up occasionally, especially when the water supply sources is compromised.
Yeah, but just as we, also, read in the news, sometime last year or so, about, 817 people, lost their lives, due to cholera, outbreak. Couldn't the government, have been more, prepared to deal with, re-emergence of the cases?
Some of us were worried because, again, the person that isolated cholera, the Vibrio cholera, the germ that causes cholera, isolated it about 200 years ago. And down the line, yes, we saw an outbreak about between 1870-something and 1924, when we had a lengthy outbreak of an epidemic or pandemic of cholera. But even up to that time, we have moved sufficiently forward to be able to provide just ordinary potable water supply. This is what we're talking about. Provide ordinary potable water supply, ensure that sanitation is topped up, educate the people, make sure that the waste are disposed properly, and it's not disposed close to source of water. And then, simple hygiene, wash your hand, and these kind of clear-cut things will be able to, stop the spread of epidemics, not just cholera alone. But what we've seen in Congo is that there has been a breakdown of infrastructure. There are a lot of, challenges, pre the election, because again, you see the influence of politics there. You see that there's a dearth of health personnel in Congo. And of course, you see that Africa is contributing so much to this outbreak because they could not actually muster a response. Recently, Africa chose to set up a Center for Disease Control with headquarters in Ethiopia. Recently, an African was elected as the Secretary General of WHO. Gabriel Jesus was elected as Secretary General of WHO. We are as the Director General of WHO. We expect a robust reaction from such institutions to epidemics like this. What we actually need to do is to be able to do what we call early warning signs, to be able to design an early warning signs for this sort of epidemic. When you see a situation whereby the water infrastructure is breaking down, where there's overcrowding, where there's no sanitation, where the hygiene is poor, of course you can actually, wait. It's just a matter of time before you see an epidemic of a cholera or gastrointestinal diseases.
So there's a sense in which we can say that the authorities haven't been proactive.
Absolutely,
as much as
absolutely. They've not been both at the level of the government and even at the African Regional Office of WHO. We've not been seeing response. It should be able to move away from announcing to us the danger of these diseases and then act, proactively. In fact, one of the major limitations which I mentioned was actually, the sewage disposal system is a big problem. What we are looking for is fund to be able to react to this appropriately. I expect at the level of the regional office of WHO for them to be able to set up what we call epidemic preparedness fund, and as a kind of emergency fund that should be ready should epidemic happen anywhere. Based on our own, based on the information that we're seeing, we can mobilize people, we can mobilize drugs, we can mobilize support and campaign to ensure that the epidemic is down and then not just spread to the whole country. And let's mark it. We remember in the 70s when Nigeria had a pandemic, epidemic of cholera. The thing was brought from another country, people that went to Hajj. So let's be careful again now, because happening in Congo means that it can also spread to Nigeria, like we have seen before.
All right. Tuyi Mebawondu, medical doctor, we thank you very much indeed for coming to share your thoughts with us.
My pleasure, anytime.
Right.